Hello everyone, it's Elizabeth, and now we are going to use our patient concept map to discuss hypoparathyroidism. So again, hypo means low, so we have low levels of parathyroid hormone, okay? And the parathyroid is located on the posterior portion of the thyroid. So there are four really tiny glands, and the purpose of these glands is to regulate calcium levels within the body. Okay, so hypoparathyroidism, the patho of it is a rare disorder, and it is decreased parathyroid function, which causes low serum calcium levels due to lack of parathyroid hormone secretion. So our parathyroid hormone is low, which then results in low serum calcium levels. It is considered iatrogenic, and that is a big fancy word for caused by a medical intervention. So it's iatrogenic because it is caused by something that the patient has had done medically. And in this case, it is because of removal of the parathyroid tissue. And that most commonly occurs during a thyroidectomy. So somebody has their thyroid removed, and those little tiny glands that are on the back, the parathyroid, those get damaged and or removed, which interferes with our calcium regulation. It could also be an idiopathic problem, which is, if you remember the medical term for, I don't know, I'm not sure, I don't know why that happened. But thought maybe it could possibly be an autoimmune issue. So a problem with the body attacking it. And they also think that potentially it could be due to low magnesium levels. Okay. And problems that might make your magnesium low include malabsorption. So you may be eating just enough things, but if you've had like a gastric bypass surgery or some other problem with your intestine, you may not absorb things the way that you should. So you may have malabsorption, which could cause low magnesium levels, or you could be taking something else that is causing a disruption in the absorption of magnesium. Chronic kidney disease is another consideration for low magnesium. And then also malnutrition, so you're just really not even taking in the magnesium that you need to be to maintain your magnesium levels. Okay, so symptoms of hypocalcemia, and if you watched the thyroid lecture, the hyperthyroid lecture we talked about, whenever we have our thyroid removed, we have to watch the patient for symptoms of hypocalcemia, and that's because if we have removed our parathyroid gland while we were removing our thyroid gland, now our calcium level is going to be low. It's going to be affected, and it's going to be low. So basically the things with parathyroid, they all just pretty much have to do with the calcium. They do also affect your phosphate levels, but we're really just going to focus on the calcium. So the symptoms of hypocalcemia, if you remember calcium, it kind of controls nerve function. That's one of its biggest caveats for calcium. So this affects things that are controlled by nerves, okay? So one of the common ones is going to be tingling around the mouth, so perioral tingling, and then tingling in the hands and the feet. A lot of times we have, very peripheral areas that have tingling first, but we're going to have around the mouth and then hands and the feet. And then muscle cramps and seizures. So abnormalities in calcium can cause seizures, psychosis, tetany, and tetany is like rigidity, like stiffening of the muscles. And then we have positive Chvostek's and Trousseau's sign, okay? So if your calcium is low, you're going to have a positive Trousseau. That's how you kind of remember that one. Chvostek's is it's like a reflex in the face. I don't know if you can see that. Probably not, but I can feel it. Like, it's like this little reflex, kind of like when you hit your knee with the reflex hammer and your knee kind of kicks out. There is a little reflex right here that like causes your mouth to twitch. Well, if you have a positive Chvostek's sign, when you tap this, it is going to be like really pronounced, where you could definitely see it and there would be no question. So if you just want to like look at a YouTube video of positive Chvostek's sign, that will show you what that looks like. And then Trousseau sign is whenever there is pressure placed. We usually use like a blood pressure cuff, and we put it on the patient's arm, and it causes it's called a carpopedal spasm, where it causes like this area to tense up like this. As we're tightening around here, we kind of get this like flexing, and you can also find a YouTube video with that. I did have a patient one time that came in for acute blood loss, and we took her blood pressure. She'd had a colonoscopy where they had removed a large polyp, probably larger than maybe they should have done, and then sent her home. But anyway, they did this polyp removal, and she was like losing massive amounts of blood by the time she came into the ER. And when they took her blood pressure, she started having this like spasm of her whole arm, and I was just like, what is happening at the time? But then when we got her labs back, her calcium was super low. So those are just some clinical signs of hypocalcemia. And then bands or pits in the teeth, which may indicate a loss of calcium. Okay. And then high phosphate levels. So if they have hypoparathyroidism, they're going to have a low calcium and a high phosphate. Those are kind of opposite. Those kind of run opposite. All right, then let's go over here to tests. So EEG, may have an EEG with that changes may occur due to low calcium. So we had talked about seizures, and an EEG is looking at neurologic brain waves, and so that might be changed due to low calcium. And then labs that we might do is calcium level, phosphorus level, magnesium level, and then vitamin D. So calcium, obviously we're checking for that on this patient, and we already said that the phosphorus may be high. We talked about how magnesium may be an underlying cause for this. So we want to make sure their magnesium's not low, because if we can correct that, we might be able to correct the calcium issue. And then vitamin D is what helps absorption of calcium. So if our vitamin D level is super low, we are going to have problems with calcium absorption. So if we give them calcium, it's not going to be absorbed if the vitamin D level is super low. So that's another test that we might do. We may also do an EKG, just because cardiac function is also controlled tightly by calcium. So we would want to make sure this patient isn't having any cardiac issues. Okay, interventions. Correction of hypocalcemia, hypomagnesemia, and vitamin D levels, which we just talked about drawing those. So yes, we want to kind of get that under control. And the fastest way that we can do that is to give IV calcium gluconate. Okay, so if our patient has, dangerously low levels of IV calcium, dangerously low levels of serum calcium, and we really need to correct that quickly because of some of the symptoms they may be having, we're going to give them IV calcium gluconate. And we give that over about 10 to 15 minutes. We don't want to give it too fast. And also we want to make for sure that our IV is patent. So if I give somebody IV calcium gluconate in an IV that is actually infiltrated, and this IV calcium gluconate goes underneath the skin, it can cause what is called extravasation, which is necrosis of the skin and of the tissues where that calcium gluconate has gone that is not in the vein. So it's safe if we get it in the vein, but if it gets outside of the vein, it can cause this extravasation, and it can cause tissue necrosis and tissue damage, and this can be months of healing for this patient, and maybe even losing some tissue. So if that's in their hand, that's going to be a big issue. So we just want to make sure our IV is patent. And then while we're giving calcium gluconate, like I said, a lot of the cardiac function is controlled by calcium, so we want to make sure that we have the patient hooked up to the EKG or at least the cardiac monitor so that we can make sure they're not having any changes. The patient will probably need to be on seizure precautions because it is high risk for having a seizure if your calcium is too low. So, I think we've talked about seizure precautions if you've watched the video on seizure. And that looks like, padded side rails, oxygen and suctioning equipment readily available, an IV in the patient, so that way we're not trying to start an IV in an actively seizing patient. So if they have really low calcium, they probably ought to be on seizure precautions. And then if their phosphate level is really high, they may need to have oral phosphate binders, which is just a pill that you give them and it kind of like attaches to the phosphate to help the body get rid of the phosphate. And those are usually taken after a meal. So that's the interventions for hypoparathyroidism. And now we're going to talk about E for extreme, so the worst case scenario. If we have severe hypocalcemia, we already said they could have a seizure and they could get injured during a seizure. It could lead to brain damage, things like that. So that's an extreme situation with hypoparathyroidism. And then heart failure, based on just the cardiac function relying so much on calcium levels. That could be an extreme situation for a patient who has hypoparathyroidism. All right, and now let's move along here to the nursing diagnosis. Oh, risk for seizure. We already knew that. Risk for seizure. Okay, no big surprise. And then teaching. We want to recommend that these patients have foods that are high in calcium to help bring up their calcium levels. Sometimes their calcium's just a little low. They have chronic hypoparathyroidism and they just have this kind of lower level of calcium. So we may just want to try to give them oral calcium supplements as well as foods high in calcium. But they actually recommend, specifically for these patients that have hypoparathyroidism, that they avoid foods such as milk, yogurt, and cheese, which of course we're thinking, oh, those are high in calcium, right? Well, they're also high in phosphorus. So these patients specifically, we do not want them to have those, okay? So we need to find other sources of calcium that are hopefully also low in phosphate. And then if they have this problem and it's kind of ongoing, they're gonna have to always take this oral calcium. And it is super common for patients who are taking oral calcium to have constipation. So we just need to teach them things that they can do to alleviate constipation because it's probably going to be an issue. And then renal stones can be a side effect of oral calcium replacement. So too much calcium kind of absorbing into the tissues can cause renal stones, which if anybody's ever had those, they are horrid and extremely painful. So just a good teaching point. Renal stones is the same thing as kidney stones. I'm sure if anybody's ever known anybody that's had one, they basically relate the pain that is associated with that with childbirth. It's pretty horrendous. So that is our discussion here today on hypoparathyroidism. Thanks for joining me.